Welcome back, everyone, to a podcast to answer your questions on addiction, recovery, and mental health by Waismann Method Opioid Treatment Specialists and Rapid Detox Center. I'm Dwight Hurst, joined as always by Claire Waismann and David Livingston, and we have a pretty special discussion today. Happy anniversary, first of all. This is
Thank you.
It's kind of exciting.
This is our 23rd anniversary. I founded the Waismann Method in 1998.
Wow.
Yeah, almost a quarter
back.
of a century we've been here.
And I don't know traditionally what is that's silver, gold, copper. I'm not sure gift wise.
Not sure, but makes you feel old a little, right?
Yeah, I would imagine. But that's quite an accomplishment too. If I remember back from our early episodes, you talked about having seen sort of a dearth of detoxification, different than you'd seen in say, other countries.
Yeah, medical opioid treatment, and my brother-in-law was actually doing similar treatment in Spain, Dr. Lagarda. We thought about bringing it here, and then I met, the doctors that helped me found this. And in the beginning, we started with detoxification under anesthesia. So that's all we did. Really fast, we understood that there could not be one treatment for all patients. So we evolved. I think I'm humble every day I do this job because I learn more and more. I feel the need to accomplish more, provide more.
So how have you seen the evolution in the industry since 23 years ago?
I think in the industry itself, I think we are moving away from, the cookie cutter approach, the stigma idea that people that struggle with addictions were lesser than, to a more scientific approach where we understand the consequences of untreated mental health. We understand the chemical changes that happens in somebody's brain function after using any kind of substance for certain period of time, regardless if they did because of pain management or social issues. So I think again we have learned a lot more about the neurobiology of substance use. So I think because we have learned, we have become less judgmental and more effective.
Yeah, it seems like that was an important thing when you opened up as well. So do you feel like the rest of the industry is caught up to those that were already looking at it that way, I should say?
I think yes, in a way, yes. But again, as we spoke before, when we started this, the goal was to get a patient through an opioid withdrawal under anesthesia. And, very fast we understood that we needed more. We needed more available protocols to detox the patient. We could not use one protocol for all. Some patients would do better under anesthesia where others would not. And we understood that we needed to do a more comprehensive pre-evaluation to make sure about, patients' candidacy for any of our protocols, to make sure of patients' health needs, metabolism, all the things that would be, major factors during treatment. But more than anything, I think we also understood that when patients are detox, they are left in a very hypersensitive space, emotionally and physically. So we, after a few years doing detoxification, we created Domus Retreat that I truly believe is our golden key because it allows patients after detoxification to gain a bit of the physical strength, a big of the emotional stability, and also with David, that is a major part of Doma's retreat. They are able to plan the next foot forward, and it's so different to every patient. What you know, what is the next step to maintain health? So I don't even say maintain sobriety. I say maintain health. What is the best option for them after that? Based on what is available for them.
No.
Because we can make a decision what's good for you, but if that's not available for you and that is not a reality for you, is another failure. So it's really important to hear the patient, to understand where they're coming from, and to find the best option of how to again maintain a healthy and somewhat happy life.
Mhm. That's really interesting to say when you look at that. I think people think of detox as one particular thing. And I know that uh, when people are thinking about going to the detox process, sometimes it's almost like they treat it like, oh, I'll just go do that and then something else, and may not weigh out the importance of those things you just said. Because if I go to somewhere like maybe a hospital that doesn't specialize in that, I know of a few in my area that they'll do a chemical detox, but I've seen real limits when someone just goes to a general medical facility. That you kind of roll the dice on if the person has specific addiction training or not. Just like if you go to your general practitioner and ask for an antidepressant, some know a lot about it, and some of them would be way better off sending you to a psychiatrist. Um,
Correct.
and
Correct.
yeah, so I can see having not a menu, that's not the right word. Myriad would be a better word, probably, of different options that meet the person's needs depending on the person instead of depending on the program.
And be able to tailor those options, not just based on your evaluation, but based on how patients are progressing during treatment.
Mhm.
So I think rapid detox got a really bad rap because of the overnight clinics.
Mhm.
To treat a patient, to detox them overnight. Number one, when you put them in the hospital, you're really not aware of what's in their system that could have, severe side effects during procedure. You don't know how their metabolism works,
Mhm.
and you don't know about, specifics about their current health. You don't have enough time to do so. And afterwards is what we were talking about. Just to detox them and send them to a hotel room with a family member, it's irresponsible to say the least.
Yeah.
Because the patient first, the level of anxiety of forget. Let's say they're doing great from the detox, just a level of anxiety of how am I going to face life, my family, the world. You have their whole metabolism trying to adjust, sleep, gastrointestinal function, endorphins, everything. Now you have a family member that is always also anxious. So the combination of both, and worst of all, you have a patient that now has been detoxed, so their tolerance level is much lower. And
And that's
if
very
he
risky if they relapse.
very risky because if they feel too anxious and they decide to use an opioid because that's what they are used to do when they don't feel well, now they're much higher risks of overdosing. So to have a place where they can, for a few days, um, stabilize emotionally and physically is crucial
Mhm.
for a responsible medical detoxification.
When did Domus become a part of it? How many was that fairly early on in the last
Fairly
23
early,
years? Yeah.
yeah, yeah. Domas, I think, is we have it for 16 years, David.
It sounds
Yeah,
right.
somewhere there. Yeah, around that.
And having brought that in, David, what are some of the things you could say about the role that the therapy and psychological approach there comes in in a detox process, a detox facility?
Well, first of all, it's really been a privilege for me to be able to be, you know, working with Claire and the Waismann Institute and the doctors for, you know, a long time, in some capacity for really in depthly for 16 years and even before that. Um, um, and this was not my, the getting involved in addiction was not my primary interest as a clinician, because really what I wanted to do was help people improve their lives. And the thinking around addiction was not necessarily oriented as such. And so when I met Claire and she and I began to talk about our philosophy of what we were going to create at Domus and the type of care we were going to implement and the philosophy and we were in alignment with what we wanted that to be, it really began to change, and I've enjoyed and continue to, because really our orientation is exactly that. It's we get once you're off of the chemicals, once you're detox from the chemicals, and honestly the way we do it, part of the part of what's so good about it is everybody gets it done. It's like you're off it. You don't feel good for a couple days, but then all of a sudden everyone's like, I can't believe I'm done. Like it's and so you help them through that. They get through that. And then there's this really a space to begin to work on and understand what are the drives and the addictions, what are the things that are being, minimized or not dealt with, in a person's life. And you actually get to begin to do some real therapy, which is about improving the individual's life and deal with, and not just dealing with suffering from a long-term process of trying to get off whatever chemicals they're on with the opioids. So it's been a privilege. And the other thing is, for the most part, people are very interested in learning and understanding, and they actually want to know, why am I doing this? And the idea that, and really my training is towards that, not just a behavioral approach. Okay, what do you do now then? That's useful. But if you don't understand why you're using it, like what's driving it, what are the problems, what is it I've got to really understand, then you're kind of, you have to understand both, as I've said many times. So it's just been a privilege to be able to be part of this.
I've had some experience, just like what you said, which is I didn't think when doing psychological training and going to school, I didn't think about addiction particularly as a area to focus. But I think the really interesting thing with it when I started doing that is that you're really working with everything as far as clinically. And that's something that, I guess we could say that to anybody out there who is training or thinking of being a clinician is think about it this way, because with addiction doesn't discriminate, right? And you may get some things that are similar with patients that come through, but you're dealing with people from all walks of life, and you're dealing with people often who have all kinds of different issues that the drugs are masking, right? And so when you're dealing with addiction clinically, you really are working with a little bit of everything, I should say, as far as presenting problems, right?
Yeah, I think you're dealing with human beings first, primarily, and human beings suffering from several different conditions, including addiction.
Yeah. If you open an anxiety and OCD clinic, you're basically working with that. If you are working with addiction, though, you're going to work with that. You're going to work with depression. You're going to work with trauma a lot of times, and abuse, and just a lot of different things, And so, and it's funny how much that makes sense because of what you just said, Claire. It's human beings going through this particular problem, this medical problem. So it shouldn't be a surprise. But sometimes, unfortunately, when we don't have, and I lacked that experience to know that, this is just a thing people go through. It's not like its own little special thing in a way. Yeah.
Right, and can truly affect everyone. I mean, we see patients, 20 years of age that started using, opiates one way or the other socially, and we treat, 80-year-old ladies that had 5 hip surgeries.
Mm-hmm.
And but I think more importantly, if we have to celebrate, 23 years of accomplishment, I think, as David was saying, um, how we view and how we treat people, regardless if it's detoxification under sedation, medically assisted detox, um, therapy through Domus Retreat. It's truly is how we treat the person. I think there is a healing that starts immediately because they come in as they came in to, treat any other condition. They are respected and they are heard, and they are able to express themselves. They are able to behave within, their own feelings. I mean, obviously being respectful to others, but I think the sense that they are being treated as a person and not as an addict, or what I'm saying. I think the healing starts there. The trust starts there, and understanding what has happened to their brains and how we are helping reverse that condition and how they can help themselves reverse that condition. I think the understanding, the respect, I think the whole package together is incredible of how fast that healing starts. One of our biggest accomplishments is even those that have relapsed, they know it is possible and they can feel well. I think something there changes, and we have been able to do that for thousands of people. I think that's truly our biggest accomplishment.
It's an interesting thing to be able. You're really talking about hope. Hopelessness plays a large role. I mean, do you see that a lot of times when people are first coming in, that they're feeling unsure or a lack of hope that they can get better?
Yes, because a lot of the patients we see, they have been through 5 rehabs, 10 rehabs. Um, People have said you're always going to have an addiction issue. There's nothing you can do. You're always going to be taking some kind of MET drug, or so it's when they see that there is solution. In the solution, it does not have to be painful or based on punishment. It can be something that is actually a good experience. Mm-hmm. Everything changes.
Yeah, there's a real feeling of not giving up on people. And I think, unfortunately, the old school kind of, you could say just the hard case approach would be to say, I've met people who have maybe relapsed or had to go through treatments multiple times, and they have to put up with people sometimes who will tell them, oh, you're just not serious about it. Oh, you just aren't, are you? And I think people think it's a tough love sometimes, but talk about a recipe for hopelessness. If you tell people, oh, you're not serious about this. And one thing I noticed that when we talk about this, I mean, with you, Claire, and with David as well, you talk a lot about the idea of just believing people when they come in and say, I want to stop. It's like, yep, you do want to stop. I believe you.
But I don't think anybody wants to suffer. I don't think anybody wants to be a slave of anything, regardless, how long they've been doing it. I truly believe that everybody, deep in their heart, they want to be happy. You see,
and
David, that fast transition, correct? That emotional transition of the patients.
I what I see is that most of the time people come in and don't really have a clear understanding of why they're using, and that we bear down on that. Some would say, well, I've got a great life. I've got a, you know, I love my family. I've got a good business. I've got, my life's working. I don't know why I'm doing this and so forth. And then you bear down on it and with them, and they're like, okay, well, how do you feel while you're doing all this? Well, I'm tired all the time. I have, I feel responsible for everybody. Okay, so the need to check out is becomes the primary need, and that's the human need. So imagine if you say, God, well, of course you've got to check out, but this isn't the best way to check out. Let's figure other ways to check out. When's the last time you had a vacation? Well, I haven't had one in 7 years. Well, you're doing so well, why not? Well, because nobody else. And you start to bear into some of these ideas and limitations they have, and the ways they've sort of boxed themselves in their life and what their needs are, and you humanize it, because we all have a need to check out. Okay, part of the reason that addiction exists is because everybody has a need to check out, but chemicals aren't a good way to check out, because they just create a whole bunch of problems and dangers. So, but the need is real. So the minute you humanize that need, and they're like, wow, you're right, I never thought of it that way, but that's true. And so all of a sudden there's hope, right? So there's hope, not just because you're interested in them, but because actually there's an understanding, and there's an excitement that you can share with them about a different way forward. So there's got to be a different way forward that they can feel and you can feel and actually make sense, and then you have to deal with the resistances around it, because there's always some resistance around it. But, oh, well, I can't let everybody down, or I don't think anybody could run the company the same way I could, or whatever it is. There's a million things. And so we try to set those things up and deal with that. But then there's hope that is foundational. And, so, I would say, so imagine all of a sudden you're off of these chemicals that have kept you bound. And then you've got a real understanding of how and why and what it's going to take to move forward in a different way, in which the needs that are driving the need for the addiction is there's actually creative solutions to it that actually you can look forward to. Okay, now you have real hope on multiple levels. And I would say that's the strength of our treatment.
Mm-hmm. Yeah, I like how you say that. The underlying need is generally something that is good, as you put it, like whether to check out or to be able to cope, right, with life. That's a good thing. We do want to be, not only does everyone need to, but everybody deserves that, right? The chance to live a happy life and to be able to do that. And it's a question of how. I like that a lot.
I think there's also, David, a forgiveness, a self-forgiveness, and because now I understand that what led me to get here. I understand that I'm not a bad person. I don't have a bad personality. It's So I think the understanding of the condition also creates forgiveness, not just with loved ones, but especially self-forgiveness, that I think is incredibly important.
That I think that's right, because part of what drives addiction is there's tremendous guilt and shame. And so when you treat people well and you're helping them understand and deal with some of the difficulties that everybody deals with just in being alive and being human and having competing needs, and and the dynamic of what it means to be a human being, and and then you begin to sort of deal and parse. You look at the things that they really should, that they are there things that you want to be, the fact that you're getting detoxed is usually means that you've already dealt with part of the guilt. yeah, I shouldn't have been on this. It wasn't good for me. It wasn't good for, okay, well, you've just dealt with it. You don't need the guilt anymore. The guilt got you here. So that's, you listen to it. So the function of the guilt that was healthy got you to detox. Okay. So now let's look at what else, right? And so you go and you can parse these things step by step by step and begin to sort of pull them apart. And like you're saying, the hope starts to materialize from this understanding of themselves, in which they begin to see themselves, they can feel themselves in a more human way, like that.
Thank you for joining us as we talk about the evolution and the development of the Waismann Method Treatment Center. The Waismann Method Treatment Center and Rapid Detox can be reached at info@opiates.com. That's another great way for you to send your questions that you would like us to feature on the show. You can also follow us at Twitter @opiates. Yep, that's right, we got that one. Or go to opiates.com. Claire Waismann is the founder of the Waismann Method Treatment Center, and David Livingston is the clinical director. Glad to have them, as always, here hosting this show to answer your questions. Keep those questions coming and keep asking questions, because whenever you ask questions, you can find answers. And if you can find answers, you can find hope. We'll be with you again soon. Thanks again for listening. Bye-bye.